everybody. The transcript has started. I'd like to welcome you to our June 26th. Let me say it again, June 26th Continuum of Care meeting. I'm so excited you could all be here today. I hope you're staying cool and out of the heat, but I know in this space with the folks that we're serving, sometimes you have to get out there depending upon the nature of your job. I was talking to some folks at CityNet yesterday who was saying in some of the high desert areas where they're conducting outreach, they're looking at changing the times of outreach just because it's already getting so blazing hot. So I know some of you are out there in this heat, so thank you so much for all that you do. Let's go ahead and move to the next slide. All right, so everybody, the link is in the chat. Make sure if you are a voting member that you click on the roster so that you can register for attending the meeting today. And then Zuli, say hello, everybody. Zuli is going to manage for us today, and she's going to let us know when we reach a quorum, right?
Correct.
Yes. Okay, so while she's keeping track of that, let me go ahead and introduce new members. Woohoo! I always love to do this. The more that we can expand the continuum of care, make it as diverse and broad and representative of all of the different important stakeholders is super important. So let's start with all persons housed. Is anybody from all persons housed in the house today? If you are, would you like to say hello?
Hi, yes, I'm here. I go by Miss Patty. How are you guys doing? So excited to be a part of this and make an impact in the community with what we do here.
Yay, welcome. And I love the name of it because in this space, housing is king. All roads lead to housing. It's like the pot of gold at the end of the rainbow, right?
Exactly.
So thank you so much. We're so happy to have you. How about Studio 6 Paris Hotel? Are you here today?
Yes, I am. Can I do like a brief introduction?
Yes, please. We'd love to hear
Okay.
from you.
Yeah, hi everyone. So I'm Dimple. We have about almost 17 properties all over California. We're excited to be in Paris, California. We have a Studio 6. It has about 105 rooms and it's an extended stay property. We provide amenities like microwave, refrigerator, coffee maker, ironing board, on-site laundry, free cable, Wi-Fi, and we're a pet-friendly hotel. Um, we have 24-hour employees and front desk. Majority of our employee has been with us for almost 10 plus years. We bought this property just a few months ago, and we did invest around 1.4 million in renovation. We did the whole plumbing, electrical, landscape, and parking lot, and continue to renovate. Uh, yeah, we're very excited to be in partnership with Continuum of Care and continue to provide exceptional service to all of our clients. And if you want a tour, please reach out to me. Yeah. Any
Dimple, can I
questions?
ask you a question?
Yes.
So are you guys contracting like with different nonprofits who use it for emergency shelter, or are you providing the services directly?
So we are in contract with few different agencies. We're just getting to start. We provide hotels, temporary stay or extended stay to any agencies that do need shelter.
Awesome. Well, that is so needed in that region of the county, and private sector partners are so important. So thank you so much for the work that you do. We're super excited to have you at the table. How about Sanctuary Homes? Is anybody here from Sanctuary Homes? No? Okay, let's go to new voting members. Center for Employment Opportunities, CEO. Anybody here from CEO?
So we'll check it out again. You have to call it in, no?
Hello? No? Okay, how about Equitable Social Solutions? Anybody here?
I'm here.
Let-
Hi, everyone. It's Janice.
Hey,
Janice with
Janice.
Hi, Janice with Equitable Social Solutions. I believe you were a voting member before, but it was under Equis, so then they changed it back to Equitable. So we're here, and we're, as always, happy to be here.
Thank you so much. And then how about mobile consultations? Anybody here from mobile consultations? Okay, well, everybody, let's give a big welcome to our new members and our new voting members. And just remember, if those of you that are with us today have not made the official application to be a member, it's super easy. You just fill out the application at coc@rivco.org. You can go on to the Continuum of Care website, or you can ask Zuli or Marielle by going to that email address that I just mentioned, the same one where you get the notices for these meetings. So we just want to make sure you all feel completely welcome. And if there's anything I can ever do or anybody else, we're here to serve you. So let's go ahead and go to the next slide. Okay, are we ready to take action, or do we still need people to?
We're almost there, so maybe we could give it a few more minutes.
Okay, thank you, Ms. Zuli. All right, let's go ahead. We'll come back to agenda item 2, since we do need to have a quorum to take action. Let's go to the next agenda item. At this time, we're going to take public comments. Members of the public may address the Continuum of Care for items that are not on the agenda. Zuli, do we have any written submissions from the public?
No, we do not.
Okay. Is there anybody with us today that would like to make a public comment for an item that is not on the agenda? Don't be shy.
Yes.
Okay, let's see. I should have. Who do we have? And if there's anyone else, just raise your hand. We'll keep an eye out. LaShonda.
Yes, my name is LaShonda Jones, and my organization is wanting to join the Continuum of Care. We are currently in a area of conflict, having to do with a opportunity through the California Department of State Hospitals. They have an infrastructure grant opportunity that's currently in play that was just recently extended through October 31st. And it has to be facilitated through the assistance of the behavioral health and the court systems in the EA office. But there's a lot of confusion around the rationale of whether or not the county has a choice of allowing us to partner with them to utilize state funds for the acquisition of housing to create more mental health treatment beds.
Have you been in touch with our RUHS Behavioral Health Department?
Yes, I have.
Okay.
And that's the problem.
Okay. Is there, I'm not sure if we, looks like, Larissa, are you with us today? I don't know if Larissa is with us today.
Good afternoon, Karen. I am here with you. I am multitasking, so I did not hear the comment, but I did hear you calling for me. So sorry about that.
That's okay. So LaShonda was making a public comment about a particular grant and collaboration with behavioral health. And I was wondering if if you wouldn't mind putting in the chat your contact information and maybe following up offline to get more into the details of what the potential opportunities and issues are.
Oh yeah, absolutely. I would love to. I'll go ahead and include my contact information and would be happy to have a conversation offline. Thank you so much, Karen.
Yes, and you know, when it comes to the continuum of care, just so you know, like we're happy to facilitate connections You know, we're always looking to improve our system. When you think about the 7,300 square mile county that we have, right, we want to make sure all the public-private partners are working together. And if there's opportunities to expand the system to prevent duplication or fragmentation or to increase collaboration, we absolutely want to do that. But as far as
I'm
like
on the
something,
call and I just got an email.
but if there's something specific, you're in really good hands with Dr. Villarreal. She's awesome, and I know
Certainly.
she'll be able to talk to you. Okay. It looks like we have another public comment, James. James, are you there?
Hello, how you guys doing? My name is James Armour from Inland Compassion. I just wanted to share that next month at our Mobile Free Market in Moreno Valley, it's going to be on the 28th from 5 to 7 p.m. at the Cinnamon Park. We're going to be raffling off a grocery gift card and a gas gift card to those who come. And at the free market, we do outreach and we provide free clothes, food, toiletries, and we have other organizations such as DPSS and yeah, it's going to be a great time. We're going to be barbecuing. So if you know any families that are in need or anyone who's on house who could utilize any of the stuff we're providing, they can join in on the raffle and it's going to be great. So just spread the word. Next month, Sandy Park in Moreno Valley, July 28th from 5 p.m. to 7 p.m.
James, do you have a flyer you would like us to distribute to the Continuum of Care? If you email it to coc@rivca.org, we'd be very happy to get it out for you.
Yes, I'll email it right now. I have a flyer that I already made.
Okay, well, we love to be able to facilitate those connections. So send it on over, and the county team will make sure to get that distributed for you.
Thank you so much.
You're welcome, Michael Peterson.
I'm sorry, I don't really have an announcement to make today, but I just wanted to find out if we could re-say the name of that grant that was extended to October 31st, because a couple people in the chat were curious about it. The one that Larissa was talking about.
I think is LaShonda still with us?
Oh, was it LaShonda? Excuse me.
Yeah. She's, I think her organization, they were trying to close the loop, and I suggested, because they need to partner with County Behavioral Health, that Larissa connect with them to figure out the details. So forgive me for not remembering the details. Does anyone remember what that was?
This is Tanya. I wrote down California Department of Safe Hospitals Infrastructure Grant is what I understood, that has now been extended through October 31st.
Nice job.
Thank you very much.
Okay, let's see. Is there anybody else? Patricia.
Yes, I just wanted to, and I'm gonna share the flyer we're hosting in partnership with Shelter Pathways on World Homeless Day in October, a resource expo for all of the homeless, the unhoused, and the low-income families. So we'll have resources such as mobile showers, emergency assistance for families that are in need. We'll have food giveaways. It's going to be a huge resource. We'll have the DMV there to print out IDs. We're looking for a judge to come and write off tickets for the unhoused that has tickets, like minor stuff like that. It's going to be a great resource day. I will email and share the flyer. And if there's any organization that would like to be there as a resource booth, you can reach out to us as well, and I will drop that information in the chat. And this is going to be in Hemet on October 10th.
Nice. Wonderful. All right. Anybody else? Okay, let's go ahead and move to the next agenda item. Okay, leadership spotlight. We're going to start with Miss Danielle. Are you with us today, my dear?
I am here, Karen. Thank you.
Okay, let me just give a short introduction to the amazing Danielle Kilchenstein with Inland SoCal United Way. I want to tell you a little bit about her. She is the Executive Director of Government Relations for Inland SoCal United Way 211. And there's a focus on local and state policy and advocacy. Danielle utilizes her passion for social determinants of health to eliminate disparities for marginalized communities. Her work aims to uplift community voice and improve health, housing, education, and financial stability outcomes through policy and systems change. She currently leads this organization's guaranteed income pilot program and directs the program's local research design. She is an experienced advocate for justice, and her health equity research is published in multiple peer-reviewed journals. In addition to her participation with the CSC for the last 3 years, Danielle is part of the Policy Advocacy Committee's Outreach and Education Subcommittee, and she remains a grateful community partner in this work. Danielle, we appreciate you so much. We're excited to hear your presentation. You have the floor.
Thank you so much, Madam Chair, and all the leadership of the Continuum Care, and all of you for the opportunity to join you all today. Quick question: should I share my slides? Will you all have them up? I'm sorry, I should have asked you before.
We have them here and ready for you.
Okay, great. If you could dive right in, that would be wonderful. Thank you. And my contact information is on the first slide, but I'll add it in there as well. Thank you so much. Next slide. So in case you aren't familiar with us, which I hope you are, so our mission is to unite people, ideas, and resources and empower our communities and improve outcomes for everyone. And we do that by focusing on health, housing, education, and financial stability. We do operate over 40 programs at Inland SoCal United Way, and we partner with thousands of organizations, many of you all here today. And I want to invite you, if you for some reason are not already partnered with us in some way, please take this as your invitation to please reach out to us. We would love to partner in any and all ways that are possible. Thank you for allowing us to join you. And together, we've assisted over 1 million households every year in the entire region. Next slide, please. And so this just gives a snapshot. So again, we really focus on the community infrastructure, economic mobility, health, housing, education, and youth opportunity. Next slide, please. And I just wanted to pull out just some of the specific projects and services that we utilize around the housing. Many of you, I think, are familiar with many of these programs, operate similar programs, or we're partnering with you. We utilize HDAP funds, also rapid rehousing. As you all know, we did implement an emergency rental assistance program that's winding down. We also work with emergency food and shelter and emergency solutions grants. And many of those services from there is case management, information referrals, motel vouchers, many of the same services that you all provide, and I hope that you're familiar with. So next slide, please. And we also work on social determinants of health too. And as Karen aptly mentioned at the beginning, right, all roads lead to housing, which we know that it's very, very important. But as people are coming in needing housing assistance and various services, we also recognize that there are other opportunities that may benefit some of our people in the community. And so we are also able to help people enroll in other programs, for example, CalFresh, broadband, various things. What I wanted to highlight is a new program that we have, but this is in the final week. So very quickly it came, and just like that, it's going to go. But we have a partnership with Lyft right now, and that covers all of Riverside and San Bernardino County. So if someone needs a ride to, for example, a health appointment, or they need to go sign up for housing, or they're going to anywhere that they need to go to get a social service or to sign up for it, or a document that they need for that, we have a Lyft program. So if you contact 211, you can just say, hey, I need a ride through Lyft, and then they can help you through that. I will note that you cannot call on someone's behalf, so you would need to be on the phone with them or advise them to contact us. So the last time I checked yesterday, we had 200 rides left. So it's kind of first come, first serve. So if you do know of any clients who may need transportation assistance, please do reach out to us at 211. We also have many other programs. I just wanted to uplift the behavioral health in our crisis line. We have a mobile crisis unit that we can dispatch. We work closely with RUHS and many of you, and just all of the variety of the health and well-being programs that we offer, again, in collaboration with many of you. But there are two specific programs that I wanted to highlight in my conversation here, and I promise I'm not going to take the whole 10 minutes. So next slide, please. So hopefully you all are familiar with our 211 contact center. And with a contact center, we collect data. And hopefully you're familiar with that data, or that you may become familiar with that data and understand that you can ask us for specific data and what that process is. So we capture as much information as we possibly can when we're helping people. And I wanted to pull some data, and this is for the calendar year of 2023. So from January to December of 2023, you can see that the highest need in Riverside County of people contacting us is housing. And I will note that during the height of the pandemic of COVID, we've seen housing, food, and utilities be the top 3 needs. And that has not changed at all. At all. As you can see, the top 3 needs are housing, food and meals, and utility assistance. And so what I wanted to do is also pull out, so that first line of housing, there's about 32% of people who contact us have a housing need. And of the housing needs on that second chart on the right, I pulled out from which specific city within the county. Obviously, they're not all listed here. I only fit what could fit on the slide. But you can see a sense of which cities particularly have the greater need that we're seeing that are contacting us for housing. So next slide, please. And this is exciting. I also like to pull this out too. We capture source of income. And what I like to make sure that I highlight all the time is that the second largest proportion of people who contact us are employed. They have jobs. Karen, you have your hand up?
No, sorry.
Okay, no worries. Just jump in if you have to, please. You know me, I get really excited about this. But we see that a lot of people who contact us, right, they are working. They are employed in some way, and yet they still need significant help. Another way that we also capture data is we look at different vulnerable populations that we very much care about. And there's just a list in there that you can see. And I just really wanted to highlight some of these as a way for you to know that we can stratify information in whichever way that might be helpful for you. So next slide, please. So if you don't already know, and in case it might be helpful for you at all, you can make a request for specific 211 data to have it stratified in whichever way you would like. We can overlay the data in different ways. For example, we can look at race and ethnicity. I always recommend you ask for that data. We can look at poverty levels. We can look at, housing and other connections. Like whichever way that you would prefer to see data, if we capture it, we're able to overlay it in that way for you. The only thing is you have to submit a request for that data. So I added it here, the link, but then I realized the link doesn't really tell you the actual website. So it's inlandsocalUW.org/request-211 data. I'm happy to put that in the chat too later, but I highly encourage you, if you haven't already, to reach out and explore, because some of the data might be helpful for you, especially as not only you're advocating, but also as you're maybe applying for grants and want to talk about the need. This is real-time data that we can pull for you. So happy to offer that as a resource in case that's helpful for you. So next slide, please. And the very last thing I wanted to highlight, because Tara did mention that I am the program director for our Guaranteed Income Pilot Program. And thank you all again for sending out the flyers. Hopefully you have seen the flyers. I just want to say I'm grateful to the COC for sending out flyers because that's how I stay so up to date with what's going on. And there's oftentimes I see something coming through and then we're able to participate. So just very, very grateful for your ability to continue to share those resources in that way. But I wanted to highlight our guaranteed income program. So we are serving former foster youth and pregnant, but the foster youth, we have filled all the spaces for the former foster youth program, which is wonderful. But we do have a number of spaces still available for the pregnant program. So if you know of anyone who is 18 or older, lives in Riverside County, is within their first 27 weeks of pregnancy, and has an annual household of income of 90,616 or less, please let them know about this program. There's multiple ways, but the easiest way, if you don't have information, is just tell them to call 211 and ask about guaranteed income. What will happen is randomly picked people will receive $600 a month for 18 months. And what I wanted to note here, which I think is very important, is that outside of the eligibility criteria, nothing else is considered. So immigration status isn't considered, and incarceration status, probation status, anything at all. If it isn't listed underneath of the criteria, those little 3 buckets right there, then it is not going to impact your ability to apply for this program. And excitingly, this is a pilot program and it's statewide. And I hear us always having conversations about how we have limited representation from our region. And this is one real way that we can have that representation from our region and make sure the state is able to consider our communities and the impacts in our area as they're making decisions on a statewide basis. So again, just really grateful for all of you and being able to share this information. So next slide, and I promise this is it. I just wanted to give you information on if you do know someone who's eligible for guaranteed income, here are the multiple ways that they can come into a door. But again, we have our own phone number, we have an email. But again, if you're out there talking to someone, just tell them to call 211 and we'll be able to get them connected in that way. So the last slide, next slide, just says thank you again for your time and the ability to be here in this space. We very much value the continuum of care and all of your partnerships. So just thank you so very much. Turn it back to you, Karen.
Thank you. And we'll see if anyone has questions. I have a couple comments. First of all, bravo. You know how I feel. I've been a huge fan of 211 really since the whole FCC approval of the concept and, you know, seeing it roll out in counties across the state. And for those of you that write grants, you know, if you look at HMIS data or like point in time count data from the report, but 211 data is also very helpful when you're looking at looking at different ways that data is categorized and collected. And Danielle gave you an open invitation to reach out to them for data. I know when I wrote the strategic plan for Corona, we looked at multiple sources of data, and 211 was a big part of that. And they have all different types of data, as Danielle mentioned. So I just want to say thank you for that because it is a really super great resource. And thank you for your leadership and everything that you do, and especially for stepping up to the plate for the Policy Advocacy Committee working group for community education and whatnot. So does anyone have any questions of Danielle? Okay.
Thank you.
All
Feel
right,
free to
thank
email
you.
me anytime. Thank you all so much.
Really nice job. Okay, let's go ahead and go to the next presentation. We have another leadership spotlight. We have Tyler Evans with us today, who's the CEO and co-founder of Wellness Equity Alliance. I'd like to tell you a little bit about him. So he does serve as the CEO and co-founder of Wellness Equity Alliance, which is a national group of population and public health experts committed to transforming public health care delivery to historically marginalized communities. During the COVID-19 response, Dr. Evans held a number of positions, including the first chief medical officer for NYC, overseeing all of the COVID-19 operations in 2020. Also, the chief executive medical officer for Curative Medical Associates, administering 2 million doses in 10 states with a focus on health equity. And then also as the deputy public health officer, chief of the COVID-19 vaccination branch at Marin County and Human Services Agency, one of the operational leads for the COVID-19 vaccination rollout with the Association of the Bay Area Health Officers. Wow. He also serves on a number of boards and executive committees, including the HIV Medicine Association, representing 12,000 HIV providers in the US. He lives in the Santa Cruz Mountains, California, with his wife and 2 young children. So everybody, welcome Tyler.
You might be muted, Tyler. We can't hear you.
Oh, still muted, I think. You're still muted.
Can you all hear me?
There we go.
This isn't Tyler, though. I'm the other co-founder of the company.
Oh, okay.
I just wanted to fill in while he's fixing his IT issue. So I co-founded the company with Tyler. I was the former state health official for the state of New Mexico up until 2019. I'm a practicing cardiologist. And I helped scale this company with Tyler because we found, well, as somebody that ran a large health department, had about 7,000 employees for the state of New Mexico, which is about 3-4 million people. It's almost the size of one of your counties, actually, but it's the size of our state. I found that we really could not, we as the health department, as government officials, really couldn't fill all the gaps that were necessary, that the health department was legislated to do, and sometimes by fiat to do. So finding the right partners, community partners, vendors, which Tyler and I really don't like that term vendor, but was very hard. So this is why we scaled this company to answer that question. I don't know, Tyler, are you online yet?
Thank you for filling.
Yeah, there you go.
Thanks for filling the gap there. Yes, my laptop typically has an allergy to Teams, and I thought we had sorted it out, but it does not appear that way. But we can flex and be nimble here. So really excited to be here. We've been talking about presenting now for a while, Karen, and I can already see from the other folks that are that have been discussing that this is a group full of kind of passionate folks, and we're an organization that really sort of leads with our heart. I think we have a few skills as well, but our heart is really the most important. And so I just wanted to take 90 seconds to allow some of our other team members to just say hi and just introduce themselves. I think we have Ludwig, Aaron, Laura, Patel, and Daniel. Ludwig, you want to start?
Sure. Very nice meeting you all. I'm Ludwig Salamanca. I'm a psychiatrist. I'm really happy to be part of the team and looking forward to improving the mental health of services the way it's providing.
And Ludwig's our Chief Behavioral Health Officer. Aaron?
Yes, thank you. I am the Marketing Communications Overseer with WIA. Looking forward to learning more about the organization and getting everyone connected and telling the story effectively.
Patel?
Good afternoon, everyone. Patel here. I'm the Enhanced Care Management Project Manager here based in Southern California, and I've actually attended a couple of these calls, so very excited to be a part of it and collaborate to make a bigger difference within our communities. Great to be here.
Daniel?
Hi, Daniel Young, the Community Health Outreach Worker here in Riverside, Palm Springs area. Thanks for being part of this.
And let's see, Laura.
Hi, everyone. Laura Shepard. I am one of the interns at WIA, and this is my first time attending a call like this. I'm very excited. So many passionate people. Thanks for having me.
I think that's it. Anybody else from WIA that did not introduce themselves? Okay. Okay, well, I'm just going to give you sort of a brief overview of sort of who we are and what we're doing here. And I will do my best to keep it to 8 minutes. Let's move on to the next slide, please. So our mission and vision, again, is really an organization that really understood a lot of the sort of the gaps in the sort of connection between health systems, clinical services, and public health. We obviously saw that during the pandemic, and many of us were very frustrated with our inability to really respond and mostly to address the needs of the most historically marginalized, because we know that they were the most at risk. And so we formed this organization to work with public health departments to be a little bit sort of more quicker and a little bit more nimble to kind of get into the sort of the nooks and crannies where where certain folks may be residing, or outside of the sort of conventional living patterns, like people experiencing homelessness. So that really was the sort of the genesis of our formation. And we've been, we originally worked with over, I think, 70 different government agencies. As Karen mentioned, we administered over 2 million COVID vaccines with our last organization, which was Curative. I think probably many of you probably got your shot with one of our operations. We were at the Palm Springs Convention Center, as well as the City of Riverside Convention Center, the Coachella Valley, and a few other places. We had some mobile units or whatnot. Next slide. As the pandemic started taking, a different sort of turn, we realized that this is not something that is not just needed for public health emergency. This is really something that was needed for blue skies as well. So we started to kind of pivot into a few different directions, and behavioral health was ultimately one direction that we knew that there were just so many sort of gaps, particularly for the most historically marginalized. So we really spent a lot of time thinking about how we could really help redesign systems and help to try to sort of build capacity to make those sort of systems sustainable. So a lot of our work has also been kind of working with alternative healthcare professionals like community health workers, community paramedics, and a few years back, street medicine really became a very compelling way for us to really sort of connect our intent to focus on, again, the connection between public health and clinical services. In a prior life, I was the medical director for Alameda County's Healthcare for the Homeless, and I also led Santa Cruz counties. I was the chief medical officer for that county and oversee all of their homeless programs. So we really saw that this was really that sort of gap that was needed, and our way of really contributing to this space was to really kind of focus on what the public health needs were. And so HIV and other kind of infectious diseases, we approach it from a syndemic lens. So meaning that basically a number of epidemics that as they coexist have a synergistic sort of effect on one another. So HIV alone, both as a doctor seeing patients in the individual sort of exam room, or if I'm seeing it in the systems level, if I'm just looking at it just as HIV, we're completely missing the point. And often behavioral health is sort of a core driver of the sort of outcomes of that care. And we know much of that is socially and politically determined. And so we're very mindful about how we approach that. And we'll talk a little bit about how ECM helps to sort of provide a bit of support for our services. Next slide. So we are, again, we are sort of innovators. We really, we've identified that there's a lot of really smart folks, a lot of passionate folks in this country and beyond. There's just things that just don't work, and it's not anybody's inherent sort of fault. It's really, it's a flaw in sort of systems and sort of connecting those systems. So we really spent a lot of time kind of innovating and ideating on how we could really just make those systems better and sort of connect those systems that are brilliant and work really well together, like FQHCs, and make sure that they can sort of connect again with the sort of public health agencies and whatnot. So we do our small part, and again, we'll be talking a little bit about our work here in Palm Springs. Next slide. We can skip that. Next slide. So, our approach as we started off as public health extenders, we started to pivot more into community health and now into population health management. We are working with a number of health plans now to really address the gaps. And I think, when we look at across the country, 1115 Medicaid waivers have such a fantastic opportunity to be able to really think differently about how we can approach clinical care and the sort of the case management and the sort of wraparound services that are needed. The reality is probably over a third of the country just will not or cannot ultimately access healthcare in the way that it's sort of set up to be. And so we need to think differently about how we extend that sort of access and really meet folks where they're at. So we're not just looking at things from a triple aim standpoint, we're really looking at it from a quadruple aim standpoint. Next slide. And so this is just kind of a description of sort of some of the communities that we work with. People experiencing homelessness or the unhoused are our primary target right now in Southern California. We do have a few different operations down in Los Angeles County, mostly around South Los Angeles. If folks are familiar with LA County, we're down in SPA 6 and 7. So that's between the city of Vernon, where I serve as the public health officer, and we've formed basically a public health department, as well as clinical services, and then down to around the Compton area. In Riverside County, we have been working with Healthcare in Action now for about 3 months. We are subcontracted with them through a direct contract from the COC to provide clinical services for the unhoused in and around the Coachella Valley area. So we have set up a program mostly it's in Palm Springs, Desert Hot Springs, also Cat City, and we're contemplating possibly expanding to Indio Coachella. Ultimately our focus again is street medicine. What does street medicine mean? For us, it's primary care, wound care, but with a primary focus on infectious disease management, so HIV testing, prevention, viral hepatitis, STIs, as well as behavioral health with a big focus on substance use. Next slide. Next slide. And one thing, I've heard data mentioned a few times during this meeting. One thing that we're really proud of is our ability to track, to basically leverage and track certain populations in a really meaningful and innovative way. So we've built out heat maps that are essentially leveraging a number of different social determinants data sets. So way beyond the social vulnerability index, plus like the area deprivation index and other indices like Healthy Places Index, et cetera. We can take a number of proprietary data sets. In the past, we've used over 100. And so we can drill down to a very granular level, down to the census block, not just down to the census tract. And then we can layer in ArcGIS using anonymized cell phone data, and we can see hour by hour where people are actually spending their time. In this map here, this was something that we had developed down on the southern border of Texas, where we had presented to the White House where we were looking to see if folks were actually where they were spending their time, where the needs were, and where the biggest sort of clusters of access barriers were. We could also look at different disease components or syndromes and identify what the risk factors were for those. So we built out something called the Urban COVID-19 Vulnerability Index. Now we're focusing more on opioid overdose and HIV risk transmission. Next slide. And importantly, we can do that to sort of monitor and evaluate, our work as well. So I think soon we should have those heat maps set up for Riverside County. But for right now, really, we've been relying on the brilliance of our CHWs, just doing kind of old school outreach it's mostly the deserts. We might have to reframe what we call street medicine and call it desert medicine. They're out there, building relationships. It's amazing. I've been out there on street medicine rounds with them a number of times. And, it's building that relationship is just absolutely so important. And we're really proud so far of building out our partnerships with the number of organizations in and around Palm Springs, including Desert AIDS Project, just fantastic group. And, we've worked with them in the past and they've just been so helpful to us. We're really excited to see how that goes. IHP, RUHS, Jewish Family Services, United Methodist Church, Well in the Desert, and the city of Desert Hot Springs, as well as a number of other organizations that I probably missed. So really excited about working with this group and really want to partner up to close this out. We do have a few slides on our enhanced care management program that Patel is going to share. Next slide.
Thanks. Thanks, Tyler. So I'm going to talk about really how we are currently implementing our ECM program. And Tyler mentioned, some of our milestones that helped us understand our communities and, bringing care to the communities that we're serving. So with that, as we're and we can go into the next slide, putting together our ECM infrastructure, we are also bringing out our street medicine services. So and that's really our differentiator. So we're providing those extra services to members who are unhoused, and we're using the GIS data that Tyler mentioned, but also being very tactful with how we are engaging with the community by doing a very thorough community needs assessment, which is what the team has been doing currently in Riverside. And that's really been our pilot program right now, implementing that. So within the Inland Empire area, currently we have contracts and funding supporting some of our initiatives, and that supports our STI testing, treatments, and SUD programs. And in addition to this, what we're also doing is really to get intimate within the community and create those key partnerships to help us elevate our efforts into a larger scale by working with others and community stakeholders. So that's really a big emphasis that the Riverside team is currently working on. And we can go on to the next slide. And we do have the Haluna funds as well. That's I forgot to mention, that's supporting the unhoused populations on the street side, medicine side. And these are basically currently, what we're looking at in terms of timeline and how we're approaching this. It's really ultimately improving the health outcomes for underserved communities and reducing the cost of care that is creating a burden in our system, as we all know. And really the gap is happening a lot of times in transitioning right throughout that patient journey. So how can we bridge those gaps by, bringing in our CHWs and really keeping care continued throughout the process. So, we're initially doing community needs assessment, finding out where these encampments are, and creating a game plan day by day to really be able to navigate also with the, constantly changing environment. So once we begin engagement, really it's about connecting with the individuals that we are trying to work with and help them and really identify what the care plan is for that individual and, put out a plan that really involves the entire care coordination team. So really we don't have that gap. And, with our follow-ups, ultimately what we're trying to achieve, and this is part of our, end goal for ECM, is can we get these individuals to graduate? Can we identify what kinds of services and care they're looking for and they desperately need? And can we bridge that? And can we ultimately demonstrate that, which is, our contractual obligations with health plans? Next slide.
I think we might be out of time.
Sorry about that.
You're okay. You're okay. Go ahead.
I'll keep it very brief. These are just some of our timelines. What we're looking at, the team has been setting up and really, getting everything geared up to make sure that we have everything we need to be able to service the community. And, July, August, and September, the next few weeks, we're really going to deep dive into that data analytics and really understanding what's working, what's not, so we can come up with creative solutions to be able to fulfill those objectives that we've set out. And that's part of being this group, really being here and discussing and learning and exchanging, ideas and resources to make that happen. So great to be here. Thanks all. And I'll leave it to Tyler if there's anything I've missed.
No, I think that was great. I think we're really trying to approach this from a from a really holistic perspective, identifying, how the social determinants are basically impacting access, and really being the connective tissue between health systems, including hospitals, health plans, FQHCs, other sort of, ambulatory centers. And, again, just meeting folks where they're at. I mean, while our primary focus is on the unsheltered, unhoused, we don't really sort of stop there. I mean, we're interested in helping with, migrant workers. We've been sort of contemplating working more in the reentry space as well. And have just gotten a few contracts in New Mexico around that space. And I know ECM has been, or not ECM, but CalAIM has been looking to basically launch their justice impacted population sort of initiative. So just kind of cogitating over that, but it doesn't stop at just working with PH, but yeah. So I mean, really happy to join the club, Karen, and we can take questions. We're probably way over time, but please reach out. I can put my email address in the chat here, and just really looking forward to collaborating with other folks.
Wow, Tyler, thank you, and your whole team. We're blown away and super impressed by the comprehensive nature of the services that you are offering, and of course, all of the expertise and background that you all bring. It's interesting that you made the jump from the public sector to the private sector. And I think what I heard you say is you feel you can be a little bit more nimble, maybe like a pretzel, and sometimes it's not so possible to do that inside of the government construct. Yep. I'd be curious to know some simple examples of where you've seen that to be making a difference. I've been in government in the space my whole life, my whole career, but I love the partnerships with nonprofits because they can be so nimble. So maybe give us like one fun example of why you can be more nimble, and then tell us, even though you have all of this expertise and you have all of these services, what are the biggest barriers that you're running into? I have a feeling I know one thing that tends to be a big need and barrier for outreach teams, but I want to hear it from you.
Sure. So I think the most compelling example of working in the private sector is really just being able to activate staffing patterns. Staffing. We're all going through this sort of this workforce. There's a lot of words to describe it. Crisis. So it's generally difficult. It's been really difficult. I've worked almost my entire career in either the FQHC or the public government space. I worked for the federal, county, state governments, and just working in the space. I have this one funny example of when I was in let's just say one nondescript county health department, and
an unnamed.
Yeah, unnamed. West for a desk lamp, for $7.99, and I was like the second most senior physician in the county, and so it's for $7.99, and like 7 signatories had to sign off on this, and ultimately it got denied, and I said, you know what, private sector, we can just get like a truckload of desk lamps, and we can get it like tomorrow, and that's really the difference. It's just you can really be flexible and nimble. I was the chief medical officer for New York City. Sorry about the dogs. I was the chief medical officer for the New York City. I was housed in the Office of Emergency Management, reporting up to City Hall. And the reason why it made a lot of sense was because with emergency management, they didn't have the sort of the contract procurement laws that sort of, naturally exist, where it takes months to years to hire, vendors, or we don't like that term vendor, but partners. So the reality is we have to be more flexible and more nimble to be able to respond to the needs of communities. And when it takes years, it takes months to possibly years to get a posting out, to get the approval, to then, hire and we don't pay very well in public health or in, kind of community health. So it's really challenging to get the right talent. So we brought on over 2,000 clinicians with our last organization, and we did it in less than 6 months. So that's probably, and there's other benefits as well, but it's not just that. I mean, it really takes a village. So you have to collaborate, with partners, and we are not competitive. I mean, we like if there are certain groups that are like, we've got this, then that's not our space. But we really, it's our intention to really be as collaborative as possible and just ask the communities, what do you need? Where are the gaps, and how can we help? So that's been key. In terms of the challenges, the most formidable challenge really are the systems that are in place that really make it difficult to access. And one concrete example of that is really enrolling people in Medi-Cal or whatnot. When you are working in street medicine, a lot of times you are not assigned to be the PCP, the primary care provider, right? So if we want to order an X-ray, something really simple, it's very difficult for us to do that. It's almost impossible. In fact, we have to get it. The PCP has to sign off on that. There are ways to get around that, but it's really, really challenging. Now with the with the new law where everyone in California essentially is eligible for Medi-Cal, that's great, but the process to get there is really difficult. And when people are unhoused, and there's so many reasons as to why that is. I mean, I say basically a third of the country is a few paychecks away from being, sort of housing insecure. When we are dealing with that situation, it's increasingly more difficult to enroll those people into Medi-Cal and do the paperwork and whatnot. So that's one of our, and then, get them to the right partners. So, building those relationships, we've already, built out relationship again with DAP and Eisenhower and RUHS, and, county DPH. And those relationships are key because we can just get it done and figure out the paperwork later. But, that's not sustainable.
I'm shocked. I thought you were going to say either shelter or especially permanent housing, because that's usually the typical barrier that outreach, no matter what type of configuration of the outreach team, is accessing, especially permanent housing. So that's interesting that you would say that. Well, we are excited to have you. Thank you so much for the opportunity to collaborate. We hope you'll let us know how we can help you, because we have all of these public-private partners. So we're all one big family. We view the system, it's one, like we need to all row in the same direction. We all need to achieve outcomes collectively. So excited to have you at the table. And I will just, before we move to the next agenda item, tell you, being part of government, and Tanya knows this about me, I'm proud to tell you that every contract I have the ability to write for our services, we use a couple key phrases: whatever it takes to provide crisis stabilization, to be able to rapidly move people from the streets into shelter and onto permanent housing. And that whatever it takes means whatever it takes to give flexibility in the contract to be able to get somebody from A to Z across the finish line. So Tanya hears me talk about whatever it takes all the time, right, Tanya? We say whatever it takes. So anyways, thank you so much. Before move on, any other questions from the members of Continuum of Care? Well, and Tanya, I want to give you credit because with your strategic mind about all of the investments from HIP infused into our Continuum of Care, I know street medicine is really super important. Did you have any final comments before we move to the next agenda item?
Madam Chair, and good afternoon, everybody. Thank you, Tyler and team, for joining us today. My only thoughts is I think are the same reactions that everybody else is having, that we're really excited to have a new street medicine provider at the table. We've known for a very, very long time that we needed to add this service in and provide our street outreach teams with tools and facilitate a way to provide immediate linkages to healthcare. So I think we are just very appreciative of this partnership. And to all of our providers that are on the line, you should know that we've talked to Tyler and his team about having them participate in the monthly street outreach coordination meetings that are hosted through Gina Morosco at the Housing Authority and are held at the Reston Center each month, so that your frontline teams on the ground can build build a stronger partnership with the team that's in Palm Springs. And so we're excited about that. And then also I wanted to highlight that in addition to this street medicine team, we also have Healthcare in Action that is helping us cover the West End. And so I know already a lot of our nonprofit providers are engaging with them. So we're just super excited about having partners in this space. And I cannot take all the credit. I think you guys have heard me say before that from our team, it was really Amy Primrose, who I know is on the call, that like day one was like, this is a critical component that we need to add to our homeless continuum of care. We need to own it and make sure that we create a space for this. So it makes sense. We're all as excited as you. And of course, thank you, Karen, for creating our COC Leadership Spotlight and inviting Tyler to present for this meeting. So special.
Awesome. And one last comment, Tyler, or question did you have?
Yeah, just a comment. I mean, I wanted to give you guys a shout out. I mean, talking about the public-private partnership, it's COC is a perfect example or embodiment of that, right? Being able to kind of, cut through the red tape and be able to kind of coordinate a bunch of, stakeholders that are just passionate about getting something done, and as a legacy HIV doc, I've been working on HIV since the 90s, the AIDS, the red ribbon is exactly that representation, to cut through that red tape and get work done, to bring a number of, it was all the different UN agencies coming together. So kudos, to you guys to kind of bringing this together. And yeah, we're healthcare providers, so obviously we think healthcare is paramount to achieving ultimately the end point, which is, permanent is supportive housing. But, housing is not the only solution, right? We need to make sure that they're sustainably housed, and healthcare, especially behavioral health, is absolutely critical for that.
Absolutely. And we should all be part of the university that provides a degree in GSD. Get stuff done, right? We should all be GSDs. We want to put GSD after our names.
Can I add one more thing? Since we're giving out so many shout outs, I want to stress from a continuum of care team perspective that our partnership with the street medicine providers would have not been possible without our managed care plan. So IEHP and Molina need to be given major kudos because they are funding the program. I think all of you have heard Karen and others share about the $40 million investment that has come through those teams, and specifically these teams are funded through that effort. So it's great to have ideas, but if you don't have the funding and will behind it to make those dreams a reality, then it's just a thought on paper. So I think Julianne and Alyssa from IHP, Dr. Ben Hadegi is also on. Thank you guys for making this a reality for us.
Awesome. Okay. Did you have any other comments, Tyler? Your hand is up. No? Okay. All right.
No, that's
super exciting stuff. So let's go ahead and move on to the next. Actually, let me ask, Azuli, did we achieve a quorum yet?
Yes, we did.
Can we go back to agenda item 2, please? Just
of
so
course.
I can keep us on track for any actions that we need to be taking. Agenda item 2, of course, is a consent item for approval of our minutes, and we need to take action to approve the May 22nd Continuum of Care meeting minutes. Do I have a motion, please, to approve the minutes? Don't be shy.
This is Charles Chapman with Mercy House. I'll make a motion that we accept the minutes as written.
No, you approve. Thank you, Pastor. Appreciate you so much. Do I have a second?
I second. Renee Hexted, DPSS.
Do I have any abstentions or objections? Hearing none, the item passes. Good job, team. Let's go ahead and go back to where we were. Okay, new business, agenda item 5.1, Continuum of Care Chair and Vice Chair announcements. Tanya Torno, take it away.
Once again, hello everybody. I wanted to take some time to talk about this item. Hopefully you've all had a chance to see my email and which formally announced and introduced Ms. Karen Roper as our chair and Michelle Davis as our vice chair for the new term of July 1st, 2024 through June 30th, 2026. We want to congratulate them, but also take time to acknowledge that I think this is the first election ever in my history, and you know that our team has been serving in this capacity since 2020, where we have held chair elections and have not received other nominations outside of the two candidates or persons serving under that existing role. So it really says a lot about both Karen and Michelle. I think we all know that they are very much so subject matter area experts in this area, but they also lead our Continuum of Care efforts with a lot of passion, drive, and commitment. You heard Karen use the phrase, whatever it takes, which is something that we have copied and pasted into every single document that we utilize. And so I wanted to just stress a few things because I think it's really, really important to recognize that our COC chairs do a great deal of work. And I know that they are most visible to you in these meetings.
After my meeting, I'll fix y'all. I'll go get dinner and fix some dinner.
Charles, we love hearing from you, but just want to remind you to mute yourselves. Our COC chairs do a lot of work, and so you know them primarily because they facilitate these meetings, but I just wanted to stress that they do a lot of work meetings, and they're also representing you and our entire system of care in various community meetings. Karen has joined us in facilitating several presentations to different cities, but also different regional groups. We joined Brian Ambroise last year presenting to the Regional Housing Alliance, and I know she has also represented the Continuum of Care at various state and federal meetings. And then additionally, we wanted to acknowledge that the chair also has an official seat on the Board of Governance and plays a critical role in reviewing funding and policy recommendations that come before that board. So it is a very involved process. And in addition to all those things, they have to deal with us and our team and you know, the inner workings of preparing for all of the different meetings and events that we host. So they have been with us and through a lot with us over the last 2 years in COVID, coming out of COVID, preparing our homeless action plan, managing all the different streams of funding that have come through, which has just been amazing, but also just a lot to sort of leverage and coordinate. So congratulations, Karen and Michelle. We're so excited to have you guys serving and supporting in this capacity. And so with that, I know Michelle really wanted to be here today. She's not here with us today, but so we'll continue to congratulate her, and I would encourage you to send her a message, shoot her an email when you see her. But I will go ahead and pause there and see, Karen, if you had a few words for the Continuum of Care. Congratulations.
Thank you. I just want to say to all of you, I just feel honored to serve. And I think in any role that we have, we need to always come at it from a servant leadership perspective, that the idea is if you're leading, you're serving, no matter who it is that you're serving. And so before the elections were happening, months leading up to it, I said to Tanya and to Heidi and other folks on the executive team, would you guys like new leadership? Do we want it? Because I don't have to run again. Do you want to see if there's other people? And obviously through an election process, people are always going to have the opportunity to submit names, but I want you to know I so much care about the perspective of HWS because they are the county lead and administrator, that if they would have told me it's time for new leadership, I would have graciously not served if I was reelected. So I want you guys to know that I feel it's so important to be a team player with HWS, and then of course to make sure that in service to all of you. And I had some key conversations with many of you and asked you questions. Did you feel that the continuum of care, the needle was moving in the right direction? Did you feel that it was time for a different leader? And those of you who I spoke to, there were a number of you, you know who you are. Thank you for being so supportive and for the feedback and for your nominations, because I know there were multiple nominations. And I just want to tell you, for those of you that don't know me, I've been in this space for a very long time, but I, have served in government for a very long time in the area of addressing homelessness and affordable housing and everything from A to Z. But I think the biggest thing that drives my passion is my lived experience. And I think you all know I have experience with family members of homelessness and mental illness and drug addiction and suicide and many difficult things in my life that really shaped me into wanting to be an agent of positive change. And so I just feel it's a privilege to serve. I hope that you will always tell us what we can do to better serve you. This is about us providing you the technical support and encouragement, funding resources, everything that you need to be successful, because the continuum of care is one big, it's like a big ship, like I said earlier. We either succeed together or fail together, and we need to think about how we all collectively make a difference. Please never be shy. Please always tell us how we can improve these meetings, how we can improve processes. In fact, today I'm excited that the team from HWS is going to tell you about some process changes for improvement. Jamie's going to tell you about that. And Tanya's always looking to try to do that. The whole HWS team is. We're really fortunate to have them. So just thank you guys for the privilege to serve. Love you all more than I can even say. So with that, we will go ahead and go to the next agenda item. And Tanya, I hand it back to you.
All right, so it is election season, and I can already see that we have some attendees here who have been nominated to fulfill one of 6 seats on our Continuum of Care Board of Governance. So we invited them to join us today and share 1 to 2 minutes about themselves and their interest in joining the board. As we do every single year, I just wanted to also highlight sort of the critical responsibilities that our board members have. Board members are one of 14 members who meet with our teams every other month, but are also called upon to attend and participate in special meetings that are needed to help review policy and specifically funding recommendations that are needed to facilitate programs that support our continuum of care and really support a variety of services, which include shelter, street outreach, and all of our rental assistance programs. So we, as I mentioned, have 6 vacant positions. And if we move on to the next slide, we will begin to call out our nominees one by one and encourage them, if you're able to, I know some folks are traveling, to turn on their cameras, unmute themselves, and again, share a little bit about their interests. What we want to stress is that the election period is closing today, but we will be accepting ballots through 6 p.m. because we want to give you time to get in your votes. And in a couple of minutes, our team is going to be including a link to the Google Share Drive where we have the ballot attached. So if your agency remember, there's one vote per agency. If your agency has not yet submitted a ballot, you can do so during this meeting or after the meeting, again through 6 o'clock. And our goal is to announce winners by tomorrow. We have our Board of Governance meeting at 9 o'clock, so the winners will be announced at that meeting, and then we'll also follow up by way of email. So for public sector and specifically our government sector, we have 2 seats available, and we will first hear from, and again, if available, if the candidate is not here, let me stress that we did send out biographies of each of the candidates, which you can also access on the Google Link Drive. But if here, Dr. Ben Haregi, we'd love to hear from you.
Hi, Tanya, can you hear me?
We can, yes.
Thank you. Good afternoon, everyone. My name is Ben Howdigi, and I'm the current vice chair of the Board of Governance right now. I've been with the Continuum of Care for, I lost track of the years, but I would love to continue to serve as a vice chair with a seat on the, continue to serve on the Board of Governors. My work experience, my education, my volunteer experience has been in this space for many, many years. Right now, I manage a team of social workers, nurses, care coordinators, community health workers who assist IHP members who are at risk of or currently experiencing homelessness. We assist them and link them to resources and authorized services, including transition navigation services, tenancy sustaining services, recuperative care, short-term post-hospitalization, and transitioning out of nursing facilities and residential care facilities. So I have that experience and at work. And I also enjoy volunteering for organizations through various activities and weekend events and health fairs and things like that. So again, I can't think of anything else to say, but I would love to continue to serve. And one other thing about me is that another thing that lends to my passion of serving our community is that growing up with my parents, we did experience periods of homelessness. My parents were migrant farm workers, and at times we moved around a lot and lived in a garage, several garages, or, we also helped by a rapid rehousing program when I was in 9th grade. So I am thankful and grateful for all the wonderful organizations that help families and individuals, and I want to continue to support all of you that are doing that work also. Thank you.
Thank you. Next, we have Gregory Kofos, Director of Riverside County Veterans Services.
Hi, everybody hear me?
Yes, we can.
Awesome. Good afternoon, everyone. I'm honored to be selected as a nominee for the public sector. My name is Greg Kofos. I'm Director of Veteran Services. Tanya said, over the past 10 years, I've dedicated my career to social services, focusing on supporting those experiencing homelessness and ensuring that they have access to the resources that they need to rebuild their lives. In my role, I've seen firsthand the unique challenges that our unhoused population and our veterans face specifically, and this experience has really fueled my passion for advocating on their behalf and ensuring they receive the benefits and the support that they really deserve. I firmly believe in collaboration and teamwork. I believe that those are essential pieces in addressing the complex issues that are within our community. And I truly think that working together, we can create comprehensive solutions that make real life differences to people. As a board member, I am committed to being a strong and vocal advocate for not only our veteran population, obviously I'm a little biased, but our unhoused and our challenged populations as well. I'll work tirelessly to ensure that their voices are heard and that their needs are met. And I believe that my background and my experiences combined with my leadership and dedication to public service will make me a very, very strong candidate for this role. And I just really appreciate you considering me, and I'm excited about the opportunity. Thank you.
Thank you. We have 3 more candidates. And again, just a reminder that there are 2 seats available under the public sector section. So next we will hear from Clarissa Cervantes, council member with the City of Riverside.
Yes, hello. Thank you, everyone, and congratulations. Just want to acknowledge everyone in their new roles, positions, and for all those being recognized today. It's wonderful to be here in the space and would look forward to being able to hopefully participate in the future. I want to take a moment. I'm Clarissa Cervantes. I serve as a city council member in the City of Riverside, and I am the new chair of our Housing and Homelessness Committee. I am proud to have I've been on the committee since I've been elected to the City Council for the last 3 years. So I wanted to put my name in for consideration, as I know our previous chair, Councilmember Erin Edwards, was able to serve in this capacity and be a strong voice as we were able to continue to advocate and fight for funding. With us being now the 12th largest city in California, and we are a big city, biggest city here in the region. We, of course, have a number of shelters that we are utilizing and that we are fighting to continue to expand, build out, and that provide service throughout the Inland Empire. And I felt that there would be a smooth transition, hopefully, to me being able to now step into this role. Since I've been involved and I worked closely with previous Councilmember Edwards, she gave us great updates at our committee, and we worked really closely together to champion a number of housing issues and projects for the City of Riverside and to fight for funding. And we've received really great different funding sources, and Michelle Davis has been instrumental for all of that as well. A little bit about myself. I'm originally here from Riverside County, born and raised in Coachella Valley, been here now Riverside for over 12 years. For myself, I actually grew up in a farm working ranch, and my grandparents, just to share, were housing advocates. We actually had several little casitas on our ranch, and they would essentially rent those out for free to different migrant workers that were coming and moving through the Coachella Valley to work. And so I grew up with my grandmother teaching me the importance of housing people and that housing is a human right. So she was always a really powerful example for me. And I've shared publicly with folks, I believe to date, I'm still the only renter on the city council. So I do come in with the lens of understanding the challenges of renting, of rent cost increases, affordability and access, also as a single mother. So that has been for me a really unique lens that I have brought in terms of housing issues and advocacy. As I always share with folks, I look forward to being a homeowner one day, but we know the challenges that many people face. And so I'm proud that my district in Ward 2 and even throughout Riverside, I've been able to help champion a number of housing projects, with my district leading in the top 2 that has built a number of projects since I've been in office. And I would love to continue to see how we can expand those and expand our opportunities across the region and to fight for all of our communities here across the Inland Empire. I would be honored to earn your vote and would be honored to be able to support and represent and be a part of the COC. Thank you.
Thank you. Next, we have Daryl Fry with Assemblymember Dr. Corey Jackson's office.
Yes. Good afternoon, my people. Hello, family members and friends, COC team. As stated, my name is Daryl Fry, representing Dr. Corey Jackson, our state assembly member of the 60th District. I live in Marietta, California myself, born and raised in Riverside County. Grew up in a single mother home. So, growing up was a little bit shaky and shifty, and housing security was shaky and shifty as well. So between 10th and 10th grade, between 5th grade and 10th grade, guess what, guys? I went to a different school every single year, different school. So I was always a new kid on the block. My family moved often because of the housing insecurity that we're feeling. So my passion really comes from firsthand experience. And also, I also empathize with my mom too, because she also was in that experience, but had kids. So my heart goes into the families who are struggling with housing insecurity and homeless families altogether. So I'm giving you 3 reasons why I feel like I'm the best candidate for this position, and amazing work to, the rest of the board and all the work you've done so far. So number 1 reason is I worked with Community Action Partnership of San Bernardino County before this role. So there, I was actually over their family development program. So this program provided the rental assistance, right? Eviction prevention, rapid rehousing, temporary motel assistance. So I'm very, very familiar about what happens on the nonprofit sector of things. I'm very familiar what happens when it comes to reporting big grants, CSBG, CDBG, ESG. So like Karen was saying earlier, I love the kind of connection between government and nonprofits, because it does kind of give us leverage to know how to kind of solve both sides of it. So number 1, I'm from the nonprofit space, now working in the government space. So I definitely think that's a huge reason why it should be voted in. Secondly, I did serve while at CAPS on the ICH, which is the Interagency Council of Homelessness. So essentially the same thing happening for this side. I kind of was on the board working on the county right next door to us, so our neighboring county. So with that, I'm excited to kind of bring that experience, reviewing agenda items, debriefing them, working with the county directly. But also I wanted to highlight that there was regional equity that I wanted to kind of make sure that was at the forefront. Because Riverside County's crazy, we're large. I live in Marietta, but what happens in Marietta is farly different from what's happening in Hemet, Corona, Norco. Hello. So Riverside County is a large county, and I want to make sure as sitting on this board, that I'm being equitable and very fair across the board. And then lastly, the last reason, I am the only candidate representing the state assembly. So I'm the only candidate representing the state of California. Why is this important? I think that it's important because, when grants come about for our nonprofits, when resources come about, when policy changes come about, I definitely think the CLC Board of Governors needs to be at the pulse of all these different changes. So I would love to be that person to be at the forefront of it and to make sure the Riverside County connects with the state of California and that we're the strongest county in California. So yeah, I appreciate y'all. I appreciate this time for me to share really briefly with you all. Again, Daryl Fry, representing the State Assembly Member Corey Jackson, humbly requesting your vote. Thank you.
Thank you. Next, we have Stephen Robillard from the City of Riverside, and I believe Chamber of Commerce.
No, City Council member.
Oh, City Council member. I apologize.
Yes.
I am so sorry. I should have read it.
No
as
problem.
Listed. Thank
Yeah,
you.
so my name is Stephen Robillard. I'm a City Council member here from Ward 3 in Riverside. I am also a member of the Housing and Homeless Committee with Clarissa Cervantes. We'll be serving together on that committee. I'm a lifetime Riverside resident, born and raised here. For a very, very long time, my experience in volunteering and giving back to the community started at a very young age. Spent most of my high school years doing disaster relief. I was a disaster relief team leader, served in Mexico, New Orleans after Hurricane Katrina, Haiti after the earthquake that struck the island, helping out all those who were displaced during those disasters. And after that, I was a police cadet during college. So I was a Riverside police cadet for 3 years. Spent many of those years interacting with our community members who are unhoused, help them get the services they need, working with them. And a lot of times, a lot of their worst day was working with them. And I'm proud to be part of that solution and helping those individuals out. And then, got into the private sector. I come from the private sector. I'm in housing development. I'm a real estate broker specializing in land sales here in the Inland Empire. Been doing that for about 10 years now, helping developers build and sell homes here in the area. Through that, I became a member of the Urban Land Institute. On the board for Orange County and Inland Empire, the For Sale Housing Council, directly involved in learning how the newest solutions and newest ways we're finding to create housing across the state. We're on the cutting edge of doing that, and I'm a part of that. And I think addressing the homelessness that is existing across our city and across our county, there is no one solution. There is lots of solutions and lots of ways. Every individual requires that special touch. And I think providing a breadth of knowledge, come from the private sector, being someone who's been part of building actual communities and building homes, and being on that side of things can provide a unique insight into what it takes to get real results and help these individuals get into housing. And also we're talking about creating housing, what that looks like and what the best practices could be for that. I appreciate your vote. I don't want to step on Clarissa's toes. We actually didn't talk about this before we put our names in, but happy to serve on this board if I'm elected. Thank you.
Thank you. Next, we are going to move over to our public sector seat candidates. For this section, we have 1 seat available. And again, we have 3 candidates. We'll start with Dr. John Shoup from California Baptist University.
Hi there. Welcome for the opportunity, or thank you for the opportunity. A bit of personal about me is that I grew up in Minnesota. I grew up with a sibling of four, grew up in a small town in Minnesota on the Mississippi River. So I tell people I was fortunate to have a Huckleberry Finn and Tom Sawyer type of life. And as a result of that, that actually motivated me to pursue a degree in social work. So I went to the University of Montana, got a degree in social work, and then I worked in residential treatment, respite foster care, a little stint with probation, and then I was going to go on and get a master's in social work, and then decided to go and get a master's in counseling psychology at a seminary that also allowed me to get a master's of divinity at the same time. And the master of counseling was going to be my professional ticket, so I worked a little in counseling, and then got into education serendipitously. And then when I got into education, ended up doing a PhD in education at UCR, in educational administration and leadership. And then when I finished my degree, I got hired by CBU, and then I ended up being the dean of the School of Education for a while, and then started a leadership institute. Was able to do a lot of things with leadership and developing people's leadership abilities, acumen, and then was tasked to start a PhD program in leadership studies, which is an interdisciplinary degree that we work with people from a variety of disciplines. So that has been my professional career. Um, so when asked to be considered for this, I welcome the opportunity because it allows me to return back to my roots and passion in social work, and then leverage my education, my learning, and then bring it back to the community. So thanks for considering me.
Thank you. Next, we have Dr. Kendrick Davis with the University of California, Riverside. Okay. He may not be here, but Dr. Kendrick Davis, if you're having technological issues, we'll move back to you after hearing from Kimberly Thomas, Norco Community College. And she may not be on either. So any of the candidates towards the end will pause and see if anyone jumps on a little late. With that, we'll move on to our next seat. Under the private sector section, we have one seat available for a business partner. And we have two candidates that you can choose from. Leticia de Lara is the first with Regional Access Partnership Foundation. Okay, doesn't look like she is here, so we'll jump over to Nicholas Addock with Greater Riverside Chamber of Commerce. I knew we had somebody from the chamber.
Well, great. Thank you. Yeah, you had it. And of course, always glad to have Stephen Robillard be associated with our organization. So good afternoon, all. My name is Nick Adcock. I'm the president and CEO for the Greater Riverside Chambers of Commerce right here in Riverside, California. I've been the CEO of this organization for almost going on 2 years, but I've served with this organization since 2009. I lead the Chamber of Commerce of approximately 1,100 member organizations and businesses representing about 110,000 jobs across the region. And one of the key things that we focus on is obviously key quality of life initiatives. And so I was very pleased to be nominated by a member of this committee to join this group. And so that's why I'm interested to learn more about the work that's being done here and potentially work with you all to elevate the quality of care in Riverside County. A little bit about myself. I'm a resident of Riverside and Riverside County for the last 35 years. I'm a fourth generation Riverside resident and been heavily involved in a lot of different community initiatives here. As it relates to the kind of work that's being done here, I spent just over 12 years as a board member with Habitat for Humanity Riverside, and obviously focused on helping families that were in dire need find home ownership as a viable opportunity for them, and working on more opportunities to bring these types of scenarios to Riverside and Riverside County residents. So I'm very pleased to be considered, and thank you all for the opportunity, and hopefully I look forward to working with you all in the future. So thank you.
Thank you. Next, we'll move over to our candidates from the nonprofit sector seat. And specifically, these candidates had to represent a victim services advocate agency. We'll start with Ernesto Rodriguez with Kindful Restoration. And let me add, for this sector, there's also one seat available. Ernesto, if you're here, we'd love to hear from you.
Yeah, I'm here.
Perfect.
Yeah, I work with Kindful Restoration, mainly with youth, troubled youth, and then also people that are incarcerated. We have programs that we go do inside of institutions, and then we're also in the reentry as they're coming out of whether it's prison or, over here in Riverside, they have the realignment project. So we're working directly with the judge and Riverside Probation to help the youth. So that's mainly what Kindful Restoration does. And then, so I have the lived experience. I was once a troubled youth. I was also incarcerated for a number of period of years. And went through the process of, taking responsibility, changing. And then, I got into the field while I was still incarcerated. And so when I came out here, I knew that I was born to do this work. And that's how I got in the field. So I bring that experience with me. I'm very, very passionate about, helping people get from point A to point B, because I've been through the process. It's not easy. Support, love, kindness are all things that we use at Kindful Restoration in our programs to really connect, not just with the people we're working with, but also the families. So that's basically what I wanted to share.
Thank you. Next, we'll hear from Sharon Jackson, Future Leaders of Tomorrow.
Hi, I'm Sharon Jackson, and I am one of the founding members of Future Leaders of Tomorrow. I am the president, and we're a nonprofit mobile unit. All of our volunteers are from the community. Many of our volunteers are young adults, college students, community members, young professionals, just people who want to do good. I would say what is unique about our nonprofit is that we're hands-on. We are literally every week, we're in the parks, the encampments, under the bridges, hands-on in the community with the unhoused. And what we find, which we all know, is many of these individuals do not have access to all of the wonderful resources that are out there. Many of these individuals are disabled. Many of these individuals suffer mental illness, lots of mental illness. So even though there's these wonderful programs that are out there, without organizations such as mine, they will not ever have means of being able to connect to many of these organizations. So that is what we do. We literally are hands-on. My volunteers, first thing I suggest is make sure you have your tetanus shot, because you're getting in the field and it is hands-on. We have our tablets. We're helping individuals sign up for what we can. We find that there are lots of stumbling blocks. Some people, they don't have their phones, the free phones, they can't get them. There's just so many situations out there, and I can go on and on. We spend lots of time calling the paramedics. Many individuals are bare feet, suffering from gangrene. They can't get up. They are literally living in their feces. So that's the real. And that is what we do. And I feel, just coming from that perspective, I think that my voice can be the voice of some of these individuals who would love to have the resources, but just don't know how to connect. And that is where we come in, Future Leaders of Tomorrow. The reason why we do call ourselves that, most of our volunteers are young folks, as stated, and they just want to do better. From my personal story, as a single mom, my children are adults, but I was homeless, I was disabled, and I found myself in that trap, so to speak. I wasn't in a situation that I wanted to be in, but unfortunately, that's where I found myself. And Riverside 211 helped me out of many crunches. So I'm well familiar with what Riverside has to offer. And that's why I feel very strong about just getting that information out there to these individuals who feel like they don't have any hope. So I hope that you see value in what I can offer to the board. I will say to each of you, we are your hands and your feet. Feel free to email me anything about your organization, because when we are out there in the field, um, pregnant women, I mean, just I can go on, and I would love to be able to provide your resources to them. So whatever you have, but it, thank you for your time, and I hope that you find me to be a great candidate. Thank you.
Thank you. Next, we have Kristen Malbay with Healthcare in Action.
Hi guys, my name is Kristen Malaby. I am currently in Arrowhead Hospital with a patient in labor and delivery, so if it's super loud, please forgive me. So I am born and raised in the Inland Empire, and I started a community organization approximately 4.5 years ago, where it led me to take care of the streets and serve on the streets. So most of my experience was unpaid. That was up until Eddie Menacho kind of found me, and we collided our resources and our efforts on the streets of San Bernardino. And we were the ones that initially started the first street medicine team here in the region. And we have grown like a wildfire. We have numerous teams now all over. You guys heard from WIA today, and we're very happy to partner with them and have them in a region that we are not able to get to and be in. So it's very exciting for us to be growing. I'm really bad at selling myself, so I'm just going to be honest. My experience isn't a degree. My experience is on the streets. If there was a degree for the streets, I would have a PhD. And so what I do is, for my company, I am now the care management supervisor for Healthcare in Action for the Riverside and San Bernardino County regions. I'm in charge of making sure that our community health workers and navigators know exactly how to move in the field. We know exactly how to navigate social services such as Medi-Cal and the insurances, the awesome insurances that we're working with currently. I am the one that will basically teach you all of the skills that you need to maneuver through serious situations, dangerous territory. It really could vary from place to place. However, if you guys ever need any guidance in that area, please reach out to me. I also too vibe with Miss Sharon. I have firsthand experience on becoming hurt on the job. I am disabled permanently from my job, and I had to learn the hard way how to navigate through the system, applying for disability, in appeals, pretty much going homeless from that experience. And so that knowledge has really stayed with me in such a way that I have a huge passion for this community and what we do. So much so that it's turned into a organization on the private time, and then my 9 to 5 during the week. And so yes, I'm here to offer my support and knowledge from my experiences, And I'm always going to be the one that's going to challenge what we're talking about. I'm going to be asking a lot of questions. I do apologize for that. It's just because I am dedicated to making a change. We've had a lot of chances, and we've moved the needle, just a little bit, but we've talked about housing being kind of like housing first, which now working in the medical field, I firmly believe that it's medical first, and housing is completely tied to health, and health is completely tied to housing. And so, yes, I'm Kristen, and thank you for your time.
Thank you. Next, we will hear from, I believe we have one or two more candidates in this section. Zuli, if you can advance the slide. Angelina Coe, Shelter from the Storm.
Hi, good afternoon, everyone. I'm Angelina Coe. I'm the Executive Director of Shelter from the Storm. I am the current person holding the nonprofit sector seat for Victim Service Advocate, and it has been my humble honor and extreme pleasure to do so. If reelected, I promise to continue to be committed to being the voice for those that have been voiceless within our system, those that have been victims of crime and victims of abuse, who are looking to end the cycle of being unhoused and being abused and being contributing members of our community. Shelter from the Storm is the only domestic violence service provider and shelter provider in the Coachella Valley. There's only 2 of us in the whole county. I reside in Beaumont, California, and have been in Riverside County since 2009, with experience on both the East Coast and West Coast in victim advocacy, nonprofit sector, and homelessness. And when Tanya shared that my time was up, I said, if nominated again, I would be willing to run again and hold this seat, because I believe that our Continuum and our BOG has been breaking the mold and breaking the silos that have been built over the years and have become a collaborative entity helping individuals that haven't been experiencing homelessness and being unhoused in our community for too long, and giving them a voice. I am the one that asks a lot of questions. I have an extensive background in fundraising and grant writing, and know how to ask the hard questions and know how our problem being that person. And it would be an honor and a pleasure and a privilege to continue in this role, to make sure that those that don't feel they have a voice can be heard, and help others learn where their voice is and be a part of the COC and continue to grow it. It is so needed in our county, and we've come so far and made such great strides. I thank you all for those that have supported me over the years in this position, and if reelected, I promise to continue to hold fast and steadfast in this role, and I take it seriously, and it's part of my mission and passion. Not only am I an executive director for a nonprofit, but I'm also a pastor outside of this role, and my ministry is to help those that don't always know where to turn for services and help them be healed, restored, and resilient in our community. So I thank you all so much. It's been an honor and a pleasure to be on the BOG, and if you're elected, I promise my commitment will continue steadfastly. Thank you so much.
Thank you. Next, we'll hear from Adriana Moreno with Safe Family Justice Centers.
Good afternoon, everyone. I do not envy all you voting members. All these candidates are amazing. My name's Adriana Moreno, like it was shared, and I am the CEO for the Safe Family Justice Centers. We are a dedicated organization to supporting survivors of domestic violence, child abuse, sexual assault, and elderly abuse, ultimately working every day towards creating safer communities. And I know that aligns with the COC and mission and objectives of this space. I feel very honored to have been nominated to serve on this board. Thank you for the nomination. I very quickly accepted the nomination. I think my experience, similar to so many of the other candidates, working in the nonprofit sector for over 20 years, working with public and private entities, organizations across different counties, Riverside County, Orange County, most recently the Inland Empire as well. very familiar with the healthcare delivery of services in systems. I heard IHP, Molina, very familiar with how that aligns and correlates with many other issues, homelessness being one of them that definitely aligns with the issues that we deal with in domestic violence and other types of community violence that the community experience. My professional experience has given me the opportunity to work not just with public and private sectors, but also with multiple systems that involve very grassroots organizations. I heard some of you also shared about community health workers, promotoras. My heart is always has a special place for promotoras. This is a model that has been proven to be very effective. Hopefully more of that is adapted as objectives come out of the space. Hopefully I've given the opportunity to promote more of that effort as well with other organizations. I think my life experience as well, as many of you as a child experiencing homelessness, being raised by a single mother, struggling with not knowing the language, limited resources, parents, and even ourselves being undocumented at some point, learning about these challenges, how to navigate difficult systems in the communities that we live. That has definitely given me the passion, the commitment to give back to my community. That's why I went into nonprofit. Continue to be committed in what I do, whatever the issue might be. There's always an alignment that I find. I think the work that we do here, we're trying to achieve through the CEOC is definitely a very holistic approach in everything that we do collectively as nonprofits, as public and private sectors. So I would be delighted to be part of this board, be part of this space to continue that conversation, that work. So if you consider me to be part of this space, it would be phenomenal. So I too consider myself an agent of positive change. I consider myself also a bridge builder. I love making relationships, coalition building with so many of you. I'm taking so many notes that even after this conversation, how many of you I want to meet with and have conversations to continue moving the efforts even outside of this space as well. So thank you for your consideration. I hope that my experience, very briefly sharing about my professional and personal experience, will move you to select me. And good luck to Ernesto, to Sharon, to Kristen, and to Angelina, also for sharing everything about you. So thank you.
Thank you. We have one more category, and that is our formerly homeless seat. This is a new seat that was recommended by you, the Continuum of Care, and then voted in by our board. So Danielle Johnson, who is a current COC Youth Action Board member, has been nominated. Danielle, if you're here, we'd love to hear from you. And she may not be on, but with that, I want to remind you that biographies of each of the candidates have been sent. And I would echo what Adriana said, that we have some amazing candidates, which once again just recognizes the value they see in the work that each of you do, but also the power that we have as a collective body to organize homeless work throughout the entire county. So thank you. And again, as a reminder, please get your ballots in. We'd love to have a vote from every single agency, and we will officially be announcing winners tomorrow during the Board of Governance meeting. Thank you all.
Thank you, Ms. Tanya, and good luck to everybody. And just a final comment, remember, it's the Continuum of Care that elects the Board of Governance. So just remember the collective power of the Continuum of Care, how important it is. We are almost out of time, and in wanting to make sure that we cover the a very critical item that affects our continuum of care. I hope that you guys won't mind if we just narrow it down to one last agenda item. John, I hope you'll be okay if we defer your presentation. I'm so sorry, but there's some critical scorecard issues and opportunities that Jamie is going to cover. So if we can give her a few minutes to, thank you for being, blessed are the flexible, John. I appreciate you so much. Thank you. So Jamie, I know you have some exciting systems improvement changes to tell us about, so take it away.
Yes, Madam Chair, thank you very much. Hi, everybody. So as some of you may know, part of our annual HUD Continuum of Care competition process is having these scorecards. And the scorecards are measured through the basis of the effectiveness of each of our projects, and they also rank each of our projects based on COC priorities. So we wanted to take out, for purposes of today, I do have the slides up for you guys of both the renewal and new project scorecards. But I plan on reviewing the two main changes to our scorecards. Some of these are just small grammatical fixes that we updated, but our two main changes. And if anybody does have feedback for us, please feel free to email us at coc@rivco.org so that way we can answer those questions for you guys, and we'll be able to email through the end of next week. Zuli, if you wouldn't mind probably going to, I think it's page 4 of 5. We're going to talk about our under our fiscal management. One of the changes that we are making, that is a large change, is the measure to cost effectiveness. This has been something that we've talked about in previous years, and we just haven't been able to get a good measure that's equitable across the board to all of our projects and our applicants. So what we're looking at is changing that wording, and the wording is measures percentage of rental assistance costs per successful housing placement. Cost effectiveness will be based on the median of the total rental assistance cost per successful housing placement. We wanted to simplify the measure that we originally had in place. The cost effectiveness will now look at how much the project spent on rent for each person who was successfully exited, and removing staff costs. So we're focusing on the rent piece of that. And this, again, keep in mind, this measure is going to be a test. So if we do determine that this new measure changes the way the overall project is scored when we're doing this process, please know that we will take this into consideration with the final scores during the NOFO season. So that is one of the two changes. The second item is on the same page. Oh, I'm sorry. Can you go to the next page, Julie? Cost effectiveness, I'm sorry, was item 17. So it was on page 5 of 5. And then the second item is under HMIS compliance. We've actually increased the possible score under HMIS from 1 point each, so a total of 2 points in that area, up to 15 points each now, which is a total of 30 points. This was a significant increase, and I think definitely needed for the project scorecards for both new and renewal. We do need to hold HMIS to a higher standard and ensure that all of our subrecipients and participating agencies are staying compliant with the HMIS charter standards, including data quality and timeliness. So we definitely fought to get those points higher for you guys, and that's going to help the HMIS team and all of our data quality and making sure that it's clean and we're not, going into those error issues at the end of our project grant terms. So with that, the total points for each of these scorecards, new and renewal, will be 120 points, which will, based upon new scorecards, 10 points for applicant, 30 points for project design, 20 points system compliance, 30 points fiscal management, and 30 points for HMIS. So those would be the two items that we wanted to talk about today, and I will pass it back to you, Madam Chair.
Thank you so much. So, one thing I wanted to make a comment on, to thank the team at HWS, these tweaks, these policy tweaks that are going to help in terms of scoring. The one in particular that Jamie focused on regarding the measure for cost of rent is really a way to be able to level the playing field, as opposed to before, I think, focusing on the staffing costs, which can be vary a lot. So I just want to thank HWS and the work that you guys do working with our consultants to make sure that we're doing everything we can to have a fair and equitable process, because we have many different diverse organizations that are applying. And if you also heard her say that this is a test, so HWS is going to look to see how these measures play out through the process for the renewals and the new projects. So thank you guys so much. And John, I do apologize because you always do such a phenomenal job when you present for a coordinated entry system. I just want to mention, if you have any suggestions for agenda items in the future, you know how you can always reach us by email, the same email that you get notifications for the meetings. We do have a very important Board of Governance meeting tomorrow, so I encourage you all to join in because you do get those notices. Some exciting things will be announced tomorrow at the Board of Governance meeting. And of course, at the bottom of the agenda, you can see all of the future meetings that are coming up. So I just want to thank you guys for all of the collective amazing work that you do to make a difference. And I look forward to hopefully seeing some of you tune in tomorrow to the Board of Governance meeting or drive out to Hemet and join us. And also to see you at the next Continuum of Care meeting. So I hope you guys all have a beautiful rest of your afternoon. Keep up the great work in transforming lives and bringing hope and a future for tomorrow for many people. Have a great day, everybody. The meeting is adjourned.